We're live. I did my best imitation of Miss Susan Gallagher, the lady with the glasses, who always says, and she didn't want to do it this morning. She didn't know you do it. So she didn't know I can do a real good imitation.
You did a real good job.
I know. We're live. And plus, I don't have the glasses that she has on. But anyway, well, there she goes. There she goes. Look, the program's ready now. Welcome, welcome, welcome to another program of Pop Barnes Health and Community Tip for the Week. We're on every Monday morning. We've only taken 2 Mondays off since in almost a year, August, right, Susan?
That's right.
So we took a couple of weeks off for some health issues that I had, my wife had, and we just needed to take a break. And so the bottom line is that we're back. The purpose of this program is to give you enough health related information that you can choose to live a healthy lifestyle, or if necessary, make informed health care decisions. And I'm always joined by 2 organizations in the community that do so much. My community partners, New Horizons Community Health and Tree of Life Health Services. And we're also partnering and have a very good relationship with the West Central Georgia Cancer Coalition, Ms. Cheryl Johnson and Mr. Michael Wobo. I am so glad to have them because, as we know, cancer awareness is really at the top of everybody's agenda. And they always come on the second Monday of the month with information, because every month is a cancer month, because cancer attacks every organ in your body. And so, they can come on really and do 2 programs in a half an hour or 2 different types of cancer, because the problem is that cancer is just so, and Harry's getting a call right now. So Harry is a blessing. He's my webmaster. So he's here this morning with me. And so what I want to start off doing is recognizing Miss Susan Gallagher. Susan, say a couple of words to
Good
our
morning.
audience who know you.
Good morning, Facebook family and friends. Happy Monday. I hope everybody had a safe and wonderful Mother's Day weekend. I know we did at my home, and just want to thank everybody for being here today. Thank Pops for making this possible, and thank Cheryl and Michael for sharing their information on cancer today. And we're in for some edutainment, right, Miss Cheryl? Aren't you the one that coined the phrase? There we go.
That's right. We're
the originator of edutainment.
I don't know. I probably got it somewhere out in the atmosphere, but yeah, we're in for some edutainment. Absolutely.
And speaking is the one who originated the word for the show, edutainment, Miss Cheryl Johnson. The West Central Georgia Cancer Coalition. Cheryl, I'm going to have you say something about yourself and introduce Michael, who we're so glad to always have and has really good information as well. So, Cheryl.
Absolutely. Good morning, Facebook family and friends and loved ones. We are so excited to be here this second Monday in the month of May. Oh my goodness. We took off April, but we're back in May. And as Susan said, we hope everyone had a wonderful, wonderful Mother's Day. But I know that there are some of my loved ones and friends. This is their first Mother's Day without their mother. And so I'd like to just offer my love and support for those because I know those first are sometimes really, really tough. But I am blessed to still have my mom and my father, and it was just a relaxing day, and so we are thankful for that. But we at the West Central Georgia Cancer Coalition, we are always doing something fun, exciting, but also educational. And we have a special program that is going to take place on the 14th and the 21st. And I'll share a little bit more about that when Pops tells me that I can.
Now is a good time, and we will do it at the end of the program. We'll do it twice, now and at the end of the program. So
absolutely. Well,
you got the ball.
Thank you so much, Pops. But we do have a program that is called Freshness is the Focus. And I wanted to see if I could share my screen. Susan, do you have to share the screen or do?
No, you should be able to just pull it up. You should just be able to share your screen.
Okay, and I'm trying to do that.
If you move your cursor to the bottom of your picture, you should see share your screen, see all participants. It's where you turn off and on your video.
No, okay, I see. Yes, I see it here. See all participants share my screen. There we go. Awesome. Awesome sauce. Here we are. Can you all see that now?
Oh, yeah,
Yes. So it's on a first come, first serve basis, but it's called Freshness is the Focus program, and we are collaborating with Mercy Med. This is for cancer survivors, thrivers, and their caregivers. And why we're doing this, because we feel and know that eating healthy matters. Eating healthy foods is about more than calories, and eating a balanced diet helps you. And so, of course, we know the fresh fruits and vegetables are help with cancer fighting. So it encourages you to stay at a healthy weight, maintain muscle strength for those who may be going through chemo, getting the nutrition you need, and a plant-based foods can aid in cancer prevention. And so we invite you to join us at Columbus's very own Mercy Med Farm for fresh, locally grown produce. Now, you must have your voucher to shop. And so we'll give the phone number out. We're giving out a $25 voucher. And you must contact us here at the West Central Georgia Cancer Coalition at 706-660-9516, extension 203. Spring up with fruits and vegetables is our theme. Freshness is a focus. You must present your voucher to shop, and the vouchers are going to be given out today, as well as we can mail them to you or make arrangements for you. But it's the 14th and the 21st from 9 until 12 at the Mercy Med on their campus. And so that's something that we're doing, that we're excited about, with collaborating with Mr. Keith there at Mercy Med Farms, and just, welcoming and encouraging our thrivers, survivors, and their caregivers in this Freshness is a Focus program. This is our first time doing this, Pops and Susan and Michael, and so we're really excited about it, and it won't be our last.
And I'm excited about this as well for something like this here. And what I like about it is that about Columbus in general, is that so many good organizations like yours and Mercy Med, of course, New Horizons, Tree of Life, can partner together for the good of community. And Susan, Cheryl, what I would like for you to do, the Columbus Consolidated Government, Isaiah Hughley and Mike King and the mayor, they're so good in passing along information. I'm positive Mike King is just super awesome. Anything that's free and good for the community, if you can email that flyer to Michael, if you haven't already, that would be really good, because Michael is so pro-community, and we're fortunate enough to have an individual like Mike King, who works for the Columbus Consolidated Government, that will take this flyer and play it often so that individuals can take advantage of it.
Yes, he is amazing. I'm going to stop sharing, and we'll bring that back up.
All right, and I'd like to also say something. You brought up a point.
Yes.
A friend of mine in Steilacoom, Washington State, gave me a chronology. I know his family well, of his mother, his wife's mother, who was in China, and showed pictures of them in China. Him when he was stationed there in the Air Force. He did a little quick thing of him and the children and whatever. And the one thing that he said, and I've seen it in the military, when things happen to individuals, they always say two words: "Oh God" or "Oh Mom," when it's a tragedy, because mothers are in a category of their own. And so Mother's Day is special, extremely special. When you figure, I've seen grown men, and with real bad situation, yours included, and what you say is, "Oh God," or "Oh Mom." That's going to show you how special mothers are. And so I don't want to hold it up. And I see Michael is very patient. Michael is just awesome.
He is.
And so Michael, will you come on and say a little bit about yourself and then get on with the presentation? But Cheryl, when you said it is kind of tough for some who have lost their mothers, and this is the first one, My grandmother was my mother, father, sister, brother, Amazon lady, Green Hornet, Superman, all in one. And it's been since 1976. And I still, on Mother's Day, just think about her as something. So thank you for bringing that subject up. So Michael, now it's the ball. You're in the ballpark. Tell everybody a little bit about yourself, and we'll get on with the presentation.
Okay. Well, my name is Michael Bobo, like you know. I always, appreciate you, Pops, for always allowing me, giving us this platform, to educate the community, on campus, which is very important. As you always say the C word. Everybody needs to know about it. Learn as much as you can. Because the more you know, the better your outcome. When it comes to cancer. Before I get into my presentation, I want to talk about, something that we have going on next month. So June is National Cancer Survivor Month. Yes, and June the 6th is actually National Cancer Survivors Day celebration. So we are planning a celebration for our cancer survivors, in this locality. It's going to be on the 6th. It's on a Sunday. Of course, COVID is still going on, so it will be virtual. We're going to do it on Zoom. But the word that I'm putting out is, you can call my number, so I can RSVP you. The way I'll do it is by getting everybody's email so we can send you that Zoom invite for the 6th. We have a theme for it. It's going to be hats off to cancer survivors. So we're going to encourage people that will attend the Zoom celebration to wear their best hat. The best hat will win on that day. So it will be a celebration. We will celebrate our cancer survivors.
So whoever has the best hat.
Yeah.
Yay! Sounds like the Kentucky Derby.
And so, Michael, I want to try to get this out as well. Okay. It's June the 6th, right?
June the 6th. It will be at 4 p.m. Eastern time. In the evening time. We'll kick it off, and it'll probably gonna last for an hour and a half or two. I'll have some guest speakers come in. I will have a cancer survivor do a couple of testimonies about share their journey and all of that stuff. But ultimately, it will be a celebration. We will be celebrating our survivors.
Well, what I would like for you to do, if you can make up a flyer, I will ask Mike King as well. I told you the mayor, the city manager is just so awesome, and Mike King is awesome. We will run that flyer. So as soon as you can get the flyer up about it with all the particulars, and let me tell you something, Mike King will run that flyer because it's as long as it doesn't entail any money, we can do that, because what you want maximum participation. And one thing that I've learned,
that's right.
That's why I'm backing, and she hasn't mentioned it though, Cheryl's Serenity Room.
Not yet.
She has not. I was waiting, Michael. I was trying to be a good host, give her the opportunity, Michael. You understand? I didn't want to try to take no thunder from her. She didn't want to give me the idea.
Well, you said I could come. You said I could come back at the end, and so I wanted.
You see, Susan. Now she's trying to twist things around.
She's covering real well. She's a pro. She knows how to cover her steps.
Yeah, she knows how to cover herself. But I'm going to have her talk about the affair they're going to be having, and also the Serenity Room. And at the end of the program, also for you to mention this on June the 6th. But I'd like for you to do a flyer. Send it to Cheryl, because Cheryl knows how to. Oh, Mike, Mike King as well. Do you know Mike King?
No, not really. I've heard the name.
Okay, but Cheryl does. Yeah. Send that flyer to Cheryl, and so I want you to have maximum participation, because you want to know something. It's like the Serenity Room idea she has. It's nothing like getting individuals together who have shared or sharing the experience of cancer. And Michael, that's why you and Cheryl are so awesome to take the time out of your schedules to do this here. So I'm going to have you mention it at the end of the show. we need to get started on the presentation. And once we get through the presentation, I want you both to come back and talk about the Serenity Room.
All
And
right, I'm about to share my screen.
there we go. Okay, Michael, you got it.
All right. So the month of May is Skin and Melanoma Cancer Awareness Month. It's also Bladder Cancer Awareness Month. And the cancer that we're going to talk about today is brain cancer, because May is also Brain Cancer Awareness Month. So what is brain cancer? Brain cancer happens when normal cells in your brain change into abnormal cells and grow out of control. There are different types of brain cancer. Some types grow slowly and the others grow much faster. As brain cancer grows, it can spread into parts of the brain. It can also cause swelling in the brain, and these can cause symptoms. So what are the symptoms of brain cancer? Often, one of the first symptoms of brain cancer is a seizure. Seizures are caused by abnormal electrical activity in your brain. A seizure can cause a person to do what? To suddenly have trouble speaking or understanding, to stay off into the space, they can lose control of their arms and legs, and pass out. Sometimes they stiffen and then, have those jerking movement of their arms and their legs. They lose control of their muscles all over their body. So that's what seizure looks like. So other symptoms of brain cancer will be headaches, often with nausea and vomiting, vision change, such as double vision or loss of vision totally, memory problem or having trouble thinking clearly, weakness and numbness in the arms or legs. Sometimes they do have show signs of personality changes.
Right.
So I have to put out this disclaimer that I put out every time I do this presentation, that these symptoms can also be caused by conditions that are not that cancer, which is brain cancer in this case. But you should let your doctor or your nurse know whenever you start having any of these symptoms. Okay.
And the one thing that I like is the fact that I always try to tell people, the good Lord made your body so attuned that it will give you signals. And just as you say, this could be symptoms of something else. The purpose of explaining the symptoms is to get people's attention and awareness. And so I'm so glad that you take the time to do that. And of course, do the disclaimer, because symptoms like that for anything should, even if it's not cancer, serious enough to seek your healthcare provider and to do tests for you.
So whenever your body tells you something, because it will tell you,
Right.
You have to react. Yes. So next
Next slide.
The question, yes, is there a test for brain cancer? The answer is yes. Doctors use imaging tests such as CT or MRI scans to diagnose brain cancer. This test creates images of your brain, pictures of your brain, and can show tumors or abnormal growth in your brain. So if you look at that picture, I don't know if you can see it closely, but is an MRI, studies. If you look closely, you can see that white shade right down probably in the lower part of that brain. That's a tumor. So
Right.
Right, you can actually visualize, abnormal growth in the brain. So after an imaging test, your doctor might follow up with another test called a biopsy. So during a biopsy, a doctor takes a very close, small sample of your brain tissue, and stick it under a microscope and look at it closely to see if they'll, detect any cancer. The right treatment for you will depend a lot on the type of brain cancer that you have and how fast your brain cancer is growing. Your treatment would also depend on your symptoms, your age, and other health problems that you have will determine what kind of treatment that they will offer you. So now the next slide. So how is brain cancer treated? We have different treatments, kind of like, the same ones that we have for other disease sites. But the first one will be surgery. During surgery, doctors try to remove as much of the cancer as possible. Often, brain cancer cannot be cured with surgery, but surgery might reduce symptoms and help people live longer. On the other hand, surgery can also lead to more symptoms or problems. This is because healthy parts of the brain, can be damaged during surgery. Remember,
Right.
the brain is very delicate. They're cutting off, a part of it. Some other parts can get damaged, during that surgery. Where the cancer is in the brain will determine how much of it that they're gonna take out. Which means if it's in a delicate spot, they might not be able to take the whole, tumor out. You have a lot of residuals in there. Then that leads to the next treatment option, which will be radiation therapy. Radiation kills cancer cells. People might receive radiation therapy after surgery or when surgery is not an option. Then that leads to the third treatment, which is chemotherapy. Chemo is the medical term for medicines that kill cancer cells or stop them from growing. People might receive these medicines during or after radiation therapy to keep the cancer from growing, spreading, or coming back. So the last treatment option that a lot of people are unaware of, because I won't say that they are new, but they are, compared to other treatment, they are, kind of. This treatment is the electrical device. In some cases, people with certain kinds of brain cancer might be able to try this treatment with a device that they wear on their head. This device creates a special type of electricity which might help slow the cancer growth down. People with brain cancer can also receive treatment for any symptoms that they are having. Symptoms like seizure. They can treat seizure, while they're treating, the cancer itself. Next. So the picture that you see is that electrical device that they have on the man's head. These days they come portable where you can take it home. It comes with a battery pack, that you can wear, or put in your pocket and have that on. I've seen people still go to work, do, all kinds of their, everyday activity with that device on their, because I think they keep it for a while, and it works. What happens after treatment? So after treatment, you will be checked every so often. Like Pops, you were talking about, the doctor telling you to come back in 12 months, in a year. But with this one, you have to get checked. I'm not sure what the protocol is, but you get checked, I want to say every month or so, So the follow-up test usually includes imaging tests like CT scans and MRI. You should watch for the symptoms listed above, the symptoms that I've talked about. You have to look
Right.
out, because having those symptoms again could mean that the cancer has come back.
Right.
Tell your doctor or your nurse if you start having any of those symptoms again. So what happens if the cancer comes back or spreads? If the cancer comes back or spreads, you might have, repeat treatment. It can do surgery, it can do chemotherapy, or even radiation therapy if it comes back. Next. So this last slide, you know, I try to put this slide in every presentation that I do, you know, because everybody needs to know or have this information, you know, even folks that don't have cancer, just in case it happens, you know, you have to have information. You know, what else should I do? It is important to follow all your doctor's instruction about visits and tests that they offer you. It is also important to talk to your doctor about any side effects or problems that you are having during that treatment. You know, getting treated for brain cancer involves in many choices, you know, such as what treatment to have and when to have it. Always let your doctors know how you feel about the treatment that they're offering to you. So anytime you are offered a treatment, these are the questions you should ask your doctor. What are the benefits of this treatment? Is it likely to help me live longer, or will it reduce or prevent some of my symptoms? You know, what are the downsides to the treatment that they are offering you? Are there other options besides the you know, the treatment that they're offering you at that point? You know, and then you also have to ask them, what happens if you turn down that offer, that treatment that they're offering you? You know, how would it affect your disease or your prognosis? So these questions you have to be able to ask your doctor, you know, in the beginning, you know, just to weigh your options, know where you stand. And that's my last slide.
Well, no, let me just tell you, as always, you do such a marvelous presentation, Michael, and this is good. And you cover everything from A to Z, because this is the type of cancer I rarely hear anyone speaking about. And of course, when you say brain, you know, the brain controls everything, and so it's a whole lot of anxiety. But as always, you cover all the bases. I like the fact, and I'm just going to repeat some things, especially this last slide, that all of it's important. But you really hit everything from A to Z. I like the fact that you told everyone about the various types of options that are available to them as far as treatment is concerned, because a lot of people may not realize all the various options. Surgery, for instance, and the fact that, you know, with surgery, when they go in, there's always a possibility that they will also traumatize healthy brain tissue. That goes with anything, heart tissue, liver, kidney, or whatever. Radiation therapy, we all know that the good thing about radiation therapy, it will kill the cancer cells, but at the same time, it does traumatize healthy tissues, the radiation. And chemotherapy as well. Everyone knows about the chemo.
That's right.
I didn't know about the electrical device, and I think that's awesome. And it's something that you can wear and utilize, and it does not restrict your activity. And I didn't realize that was a modality of treatment. I didn't realize that was an option, an electrical device. And so you educated me really on that one. And going back down to the last slide is awesome, because these are the questions that I always try to tell people in the community to ask. And what are the benefits of the type of treatment that the doctor recommends? Will it help me? Here's the biggie. And will it help me to live longer? That's the biggie. Because people need to know, and they need to make the option choice, because some treatments are very interrupt your quality of life.
Right.
Like the young lady I think I told you about, she just told my daughter, say, that's okay, I'm not enjoying life anymore. And so, or will it reduce or prevent symptoms? Because there's always going to be some types, when you receive treatment, there's always going to be some type of symptoms from the treatment.
Right.
Here's a biggie. Are there other options besides the treatment? Because the doctor will offer you what the physician feels is the best option, but you're the patient. You need to make that decision, what you feel is the best option for you as far as treatment. And then, here's the one. What happens if I do not have this treatment? All of these questions are important, and that the patient should verbalize to the healthcare providers and to get responsible answers from them. So I appreciate you taking the extra step on this. It's a really good
And
issue, brain cancers. I didn't mean to cut you off.
if I have to add, I'll say, some patients are not able to communicate very well or ask all the necessary questions. That's why you should take somebody with you that can do that.
Right.
Even some patients that can verbalize it very well, but just because that they are the ones going through it at that moment, they're not able to. They're not thinking straight. They're not thinking about all of that stuff. But if you take somebody else, they can do the asking. They can do the talking.
Right. And you're right. And thank you again for that. As always, the West Central Georgia Cancer Coalition does an excellent show. I'm not going to go ahead. Go ahead, Cheryl.
No, I just wanted to add a little piece to that. This is something that we do with our clients, but I have started giving our patients journey journals, which is they're able to journal their journey as they're going through. And so like these questions that Michael was saying, they can write those in there along with the person that they're taking, because when you've been diagnosed with cancer, your mind starts spinning. You don't hear everything. Someone else may not hear everything. And so this is also a way to transcribe, which also goes back to that mental health piece, Susan, with our cancer patients, that they're able to look at what they've gone through day by day, week by week, month by month. And then at the end of that cancer journey, I mean, you're never ending it, but from diagnosis to being in remission, that you can go back and be appreciative of the things that God has allowed you to go through.
Exactly.
Just as a gratitude journal. I call it a journey journal, but that's something that we try to give to all of our patients.
And then speaking about something like that, that jumps off into the Serenity Room, where individuals can sit down and I know that was a good segue, can sit down and speak about the common things they're going through, because nothing helps you more than having other individuals who can identify with you. And that's why the Serenity Room is so good, because it's a place where individuals who are on that journey can sit in a room quietly and share common experiences with individuals who are experiencing those same or have experienced. This is something that maybe a lot of the caregivers, family members don't. And it's good to share common experiences. And so let's do two things. I'd like for you to give a short talk about the Serenity Room, because I'm hoping there's more progress going on that. Let people know what is needed for the Serenity Room, and that's that MONEY. Money. No amount is too small. You can start with 5 cents, a quarter, $1, $2, or whatever. All's appreciated. Then I want to talk about the fair with Mercy Med, and I want to end it with Michael talking about June 6th and the flyer that will be on CCG TV. Okay, Cheryl, Serenity Room first.
Absolutely. And of course, because we're still in the pandemic, we are still working on the Serenity Room and getting it ready. We've gotten it painted, and we're looking at, getting those inspirational messages and verbiage, to be placed on the wall. We already have the lights that are there that can be dimmed. So when you go into the room, it is a place of peace, a place that's serene, where just, cancer patients can come, or thrivers can come and just relax, just have a place to get away from the hustle, the bustle of going to appointments, of going to treatment, of going to what have you. And so it is a non-medical, I guess is what we're trying to say. But once COVID we're at a point where we can allow people to start coming into the building. It won't be a crowd, but it will be managed. You could set up appointments, and that's what we're working on, setting up appointments where they can just come and relax and listen to some quiet music or read a nice book or just a place of peace. So the Serenity.
I'd like to interject something here. You already got it painted. Let the people know, because there's some people that won't do money, but they have the skill and maybe some material that they can use to donate.
That's
so
right.
What is necessary? I know you talked about the walls done. You're talking about the floors. You're talking about having a table. You're talking about having chairs for them.
Yeah. That's right. Absolutely. And if someone, would like to donate some inspirational words or the table, because right now it is a conference room, but we're turning that into the Serenity Room. And the table we have is a conference room size table. And that's something that we don't want. We want to make it smaller, more intimate, more appealing to someone when you come in to relax. So a new couch would be nice, new table, new chairs. Now let me say, because of COVID, we can't accept used furniture because for the patient and the client. So if there's a furniture store owner out there, who would be willing to donate to us, or someone who wants to purchase it for us, we are more than happy to accept that. We have to be really careful with the things that, have been, utilized because of cancer patients.
And I think you were talking about linoleum for the floor.
Yes, linoleum.
It's not that big a room, so it wouldn't take that much for someone to donate linoleum for the floor, right? And put it down for you.
Absolutely.
Okay.
So if there's a flooring owner, out there who wants to donate the supplies, and if there are some not brick masons, but some carpenters who can come and do that, we are more than happy to accept those donations.
There we go.
Call at 706-660-0317. My extension is 205, or you can just call that number, ask for Cheryl Johnson, and just say, hey, I want to help make this Serenity Room come into fruition. That's what we'd like to do. Absolutely.
And your location is?
Our location is 633 19th Street, Suite B, as in boy. We're on the back side of the building. A lot of times people try to come by and find us, but we're on the back side of that building. But we do encourage you to give us a call first before you come, right, because our hours vary due to COVID and due to activities that we have going on. Now, let me say this. I have an amazing staff. There are staff of myself, LaWanda Waits Arrington, who is our office manager and special projects coordinator, as well as Darla Spencer, who is the navigator, the case manager. And so with those two other people full-time, those are the persons that are here. And so we're kind of all over. So we encourage you to give us a call and just let us know that you're going to be coming by or set up an appointment. And we're more than happy to accommodate. So also, green can be donated. We have our website, wcgcc.org, that someone can go on and you can donate and put in the note section Serenity Room. Or if you want to sponsor someone to get a free mammogram, put that in the note section. Whatever you're making the donation that we consider as restricted funds, that you want it restricted to that specific area, please do so. Like us on Facebook. We are there on Facebook. We are there on Instagram, and we're also on Twitter. And last but not least, we have a special program that is coming up in the month, well, actually this month, and it is called the Freshness is the Focus program. And I'm going to share my screen really quickly if I can find it. Let's see this window here. And it is in collaboration with Mercy Med for cancer survivors, thrivers, and caregivers, May 14th and the 20th from 9 until 12 a.m. We're giving out vouchers $25. This is free. It does not cost you anything. This is our community benefit. This is something that the West Central Georgia Cancer Coalition, along with our state funds, we're giving back to our survivors, thrivers, and their caregivers. You must present your voucher to SHOP. And in order to get the voucher, you must give us a call at 706-660-9516. If you're unable to come by today between the hours of 10 until 12 to pick up the voucher, we will get that voucher to you. Spring Up with fruits and vegetables. It's important plant-based foods can aid in cancer prevention. So it's a first come, first serve. We have limited quantities. So we encourage you to please give us a call at that number. And we're going to be at Mercy Med the 14th and the 21st. You cannot just show up to Mercy Med without your $25 voucher. You must get your voucher from the Cancer Coalition. Thank you so much, and you all have a blessed one.
And Michael, would you talk about
Yes.
June the 6th?
Yes, so June the 6th is National Cancer Survivors Day, and we are planning on celebrating our survivors. We have a theme for this year's Survivors Day celebration, and the theme is hats off to cancer survivors. Of course, we have COVID, so we are doing this virtually on Zoom. You can call this number to RSVP. So my number is 706-321-6603. Let me repeat it again, 706-321-6603. If you call, I'll get your email address so I can send you the invite for the 6th. So it'll be a celebration. You know, it will be on a Sunday by 4 p.m. That'll be after church, you know. And we'll celebrate our survivors. Okay?
Thank
And
you, Michael. And I want to thank you and Cheryl for coming on every second Monday, giving the community valuable information, because cancer is no longer a diagnosis of cancer. Thanks to the wisdom that the good Lord has given all of the scientists, it is not a death sentence any longer. But the issue is getting the information out to the community. And that's my purpose for this program, is getting the information out to you. You heard Michael talked about all the symptoms. He talked about the treatments, even the questions that you need to ask. And Cheryl was talking about all the supportive things that the West Central Georgia Cancer Coalition has, including the Serenity Room. And so I just feel that I appreciate so much these organizations that come on, New Horizons, True Life included, that will share information to the community. And so thank you all again. Thank you, Cheryl. Thank you, Michael. Thank you, Susan.
Thank you so much for it.
Thank
We'll
you,
see you next
Pops.
month.
very much.
And as I always say when we leave, until next time, please be good and kind to yourself, because God loves you. Bye-bye now.
Bye,
Bye-bye.
everybody. Bye.
Already, I got to call Susan.